When starting Ruxolitinib, be sure to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice daily. If you have trouble swallowing the tablets, talk to your doctor about alternative methods of taking this medication. Your dosage will be determined by your medical condition, lab tests, response to treatment, and other medications you may be taking. Be sure to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. To reduce your risk of side effects, your doctor may start you on a low dose and gradually increase it. It's important to take this medication regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. Do not stop taking Ruxolitinib without consulting your doctor, as suddenly stopping the medication can worsen certain conditions. If you experience symptoms such as fever, trouble breathing, dizziness, or unusual bleeding/bruising, consult your doctor right away. Let your doctor know if your symptoms do not improve or if they worsen. Some common side effects of Ruxolitinib tablets may include dizziness, diarrhea, headache, weight gain, or gas. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist promptly. It's important to know that serious side effects are possible when using this medication. However, your doctor has prescribed this drug because they have determined that the benefits to you outweigh the risks of potential side effects. Your doctor will monitor you carefully to minimize these risks. Notify your doctor immediately if you experience any serious side effects, such as unusual tiredness, easy bleeding/bruising, or unusual skin changes. Additionally, this medication may lower your ability to fight infections, making you more susceptible to serious infections. Contact your doctor if you notice any signs of infection, such as a persistent sore throat, fever, or painful skin rash. There is also a rare but serious risk of developing a brain infection known as progressive multifocal leukoencephalopathy, PML, while taking this medication. Seek medical help right away if you experience symptoms such as clumsiness, weakness, sudden changes in thinking, difficulty moving your muscles, or vision changes. Before using Ruxolitinib, it's important to inform your doctor or pharmacist about any history of heart disease, stroke, cancer, or other risk factors for heart disease. Discuss the potential risks and benefits of treatment with your doctor, and seek immediate medical help if you experience symptoms such as chest pain, sudden dizziness or fainting, or sudden/severe headaches. While it is rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed, be sure to contact your doctor or pharmacist. In the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before taking Ruxolitinib tablets, it's important to talk to your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have had infections in the past, have kidney or liver disease, or have had cancer. Ruxolitinib may cause dizziness, so it's important to avoid alcohol or marijuana, as they can make this dizziness worse. It's also important to avoid activities that require alertness until you know how this medication affects you. This medication may also make you more susceptible to infections, so it's important to stay away from anyone who may have a contagious illness. It's also important to talk to your doctor if you have been exposed to an infection. Before getting any immunizations or vaccinations, be sure to inform your healthcare professional that you are using Ruxolitinib. It's also important to avoid contact with people who have recently received live vaccines. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. It's also important to note that it's unknown if this medication passes into breast milk, so it's best to avoid breastfeeding while using this medication and for 2 weeks after stopping treatment. Be sure to consult your doctor before breastfeeding. When taking Ruxolitinib tablet, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with ruxolitinib tablet include other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab. Be sure to discuss any concerns about potential drug interactions with your healthcare provider. To ensure the medication works effectively and safely, it's important to follow your doctor's guidance on the daily dosage and the optimal timing for taking ruxolitinib tablet. If someone has taken too much ruxolitinib and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others. Before starting this medication and while taking it, it's important to have lab and/or medical tests done, such as complete blood counts, cholesterol/triglyceride levels, and skin exams. It's important to keep all medical and lab appointments. Be sure to consult your doctor for more details. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed one. When taking ruxolitinib tablet, it is important to store it at room temperature away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When you no longer need the medication or it has expired, be sure to properly dispose of it as instructed by your pharmacist or local waste disposal company. Avoid flushing it down the toilet or pouring it into a drain unless specifically directed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.